Thank you, Piyush. We appreciate being invited here. Jan, it's good to see you.
Good to see you again.
Seems like it's been weeks. So we're happy to be invited here to speak about big data in healthcare. We'll keep it a very informal chat. Jan, the first question I have for you. Healthcare is so different from other industries. And when we look at other IT-based industries, we think about big data as massive amounts of information flowing very well. Healthcare doesn't really work that way. What is big data in healthcare?
Right, and I think people kind of know the traditional definition of big data, the 4 V's and so on. But in terms of how we're looking at big data in healthcare, first of all, the legitimate question is there big data in healthcare? Because if you look at healthcare data, it's all siloed. It's all in different small groups of data. And we certainly see this at Kaiser. We have over 5,000 databases, of which 30% of our data stores is actually part of the medical record. But even within the medical record, on regulatory reasons, department reasons, all kinds of other reasons, the data is siloed, the governance varies, and the access to data is very tightly controlled. So it's a little different than normal industries where you can have access to all the data and you theoretically could do the analytics and return the insights.
So if we don't really know what big data is in healthcare, is there really a drive to try to figure this out? What is the push? Why do people care about big data in healthcare?
Right. I think there are a couple of really important macroeconomic drivers for what's happening today in healthcare. One of them, of course, is the cost of healthcare. And with costs, increasing costs, comes a concern among the payers, including CMS and other big payers, of what kind of value are they getting for the money. And of course, when you talk about value for money in terms of healthcare, you have to look at data. And so they're very interested in getting data, and that was part of the initiative, part of what was behind the initiative to have every medical group in the country have a medical record so we can start collecting the data.
So if we have these medical records together and each institution has a lot more information than they did a decade ago, are we seeing that interesting efforts are underway to actually improve care, or is this still just a pipe dream?
Well, I think we're starting to see the early signs of people living with the future that their practice, their performance is going to be a lot more visible to the public, to their groups, their peers, and also to the consumer. And I think that implies major changes in terms of how medicine is run and financed. And I think, the fact that people are starting to want quality data and self-reporting data and finding out how expensively you treat the same patient versus the guy down the street, those kind of questions never used to be looked at. But with data, we can actually figure out what is the value for the money. Yeah.
So the government wants to improve outcomes and reduce costs. They've put many mandates and initiatives in place. In healthcare, we have meaningful use and accountable care and payment reform, Obamacare. Does the government think of big data as important, and do they see any potential benefits in terms of their goals of reducing costs and improving outcomes?
Right. I think as most people know, the US spends the most in healthcare in this world, and we don't get the best results. And I think part of that has been a sort of opaqueness about what actually happens in healthcare. So our government is very, very interested for a number of reasons. Cost of healthcare is, as you know, taking a greater and greater part of the GDP. Number two is that we're going to have a shortage of healthcare resources in the future, and the reimbursement per consumer, healthcare consumer, is going down. So because of that, we really need to, number one, optimize what we are doing. Number two, maybe look at new care models based on technology and things like that.
So if small data in healthcare is a small hospital that has maybe an electronic record, is using bits and pieces of information here and there, but not really influencing the care processes, just using it to pull up and know a little bit about a patient. And maybe if big data is a large state that has a health information exchange and is passing full medical narratives and is extracting the information for analytics to find populations, have you seen many instances of big data in healthcare?
There have been a couple. In the early days, in 2004, one of the notable examples was the case of Vioxx, which is a drug that was released by Merck in 1999 after FDA approval. That drug was a blockbuster. It was about $2.5 billion a year for Merck. But after about 4 or 5 years, people started to see worrisome cardiac problems with people taking that drug. So Kaiser was actually involved in a study to look at about 1.4 million people, Kaiser members, who were on Vioxx and comparing them versus somebody else, some of the medication, and found a much higher incidence of cardiac events and heart attacks. So they published it, and a month later, Merck pulled the drug. Now that's an example of a post-release surveillance type of function, and that's definitely big data. That's looking at all kinds of factors because we weren't sure what was actually happening with the drug, even though this drug had been FDA approved. So that's one example. A second example, maybe more on the consumer side, is Google has been using a search engine to find the popping up of influenza based on people's searches across the globe about 2 weeks before the government agencies find it, and with about 97% accuracy.
So Kaiser has one of the largest data stores in healthcare in the world.
Right.
And that means it's your responsibility to make use of the data. We hear that you can use this for Vioxx, for a single drug. Have you run all drugs through the system? Have you pulled all patients? Why is it just drugs? Can it be procedures and other interventions? Is there a responsibility in big data in healthcare to define the new standard of care based on data rather than just based on these little randomized trials?
Well, I think it raises a number of questions. One of the questions is the whole paradigm of healthcare is changing. And what I see is there's actually a spectrum of the way people deliver healthcare. On one side is the gold standard, which is randomized controlled trials. On the other side which is the way that most people practice medicine, is anecdotal medicine. And what data analytics gives us, it gives us a huge boost to the anecdotal part. So it's a statistical medicine. And a lot of doctors are still, depending on what side of the fence they're on, having a great amount of difficulty trying to figure out how they should practice medicine. Can you practice based on the fact that 100,000 people like this patient did better with a certain drug? So that's one issue. The other issue is personalized medicine versus population medicine. Data can be used both for the aggregate to try to data mine and find new discoveries and potential problems and optimizations. On the other hand, which is really exciting, is to use all the data that you have about a patient to find out the best way to intervene and to treat them, including how to best motivate them and how to involve and engage them.
So if I come into a hospital or a clinic with hypertension, I would probably fit into a randomized trial that was done on hypertension, and everyone would know how I should be cared for. On the other hand, if I come into a hospital with an unusual condition, septic shock, but I have diabetes and I have lupus and 3 other conditions, there's no study that's been done for that patient. Is there any sense that data-driven approaches might help that patient to get personalized care?
Right, and I think that's part of the potential answer. That's why people are so excited about the data, is that when you have complex patients, which is just about everybody, nobody really fits into a clinical trial. If you have complex patients, then you really don't have a gold standard referral, a reference to refer to. So you have to extrapolate. But what you can do better than that is actually look at the data for those people. What happens in the population for those kind of folks. And so you can sort of statistically surmise what is the best way to handle those folks, or give you evidence to maybe launch a study, a full study to look at that. The other issue is that with the randomized controlled trials, typically it takes years for you to find the results. And the way that technology is moving today, it's really difficult to argue that that's a viable model to keep up with the pace of change, because technology is changing so fast. In fact, we always see studies for telemonitoring and telehealth, for instance, using technology from 5 years ago. And so what's the value of that study? That's a question.
So I've been a patient before, you've been a patient before.
Yes.
We care about our national healthcare system that should give us high quality care. We know that big data can influence our quality of care, and yet we know on a day-to-day basis it currently is not. Do you have a sense of the challenges to getting this implemented and the timeline with which I can experience better care based on these technologies?
Right. Well, there are actually a number of challenges today that I think physicians and patients really want the best. You know, they want the best care to be given, the highest quality care for the most affordable price and so on. I think most physicians, most patients would want that. But there are still a number of challenges having to do with the legal structure, the regulatory structure, the governance, everything else that has been part of traditional healthcare and always changes much more slowly. For instance, by regulation, you know, your mental health data is kept separately from the medical record. You know, that's something you can't touch unless you have special access. For instance, in terms of technology, most medical records don't make it easy for you to access data. And this is something that's true for our record, true for many, many vendors. There is a reluctance to open up and allow the data to be liberated in a sense. And that's true for most vendors. There are many other barriers, mostly having to do with a structure that's already in place, and it's going to take a while to catch up with the rate of change in terms of technology.
So if these barriers are here and they're an ingrained part of healthcare, and they're actually legislated and created through regulation, is there any sense that big data can start to influence care? And if so, are we looking at some changes today? Are we looking at 5 years before a patient experiences a change, or are we looking at 10 years?
I think there are different areas. For instance, in the area of quality improvement, we are already using data. There's an existing model that people can use, and so if they automate that, that's a lot easier to accept. There's population disease management research and things like that where we're already starting to use, we already have been using population data. So biomedical research is another one. That area, you know, people do research, they share the information, and you use that data, you try to synthesize that. But I think for the practicing physician, today they're already getting too much data. That's the issue. So the question is, how do you make the data into information, and how do you make that information actionable so they can actually use it day to day? And that's a big step, and that will require the physicians to get involved, and it's going to take a while. Yeah.
So if right now it exists in the form of manual data pulling, quality improvement processes, and in the research realm, we see big data being used at Stanford and other institutions. And we see Kaiser just beginning to implement. You're at the forefront of implementing big data approaches in healthcare. Can you name something tangible that you believe will actually influence care within the next couple of years, where a specific patient will have a specific benefit at your institution?
Well, I think one of the things we're looking at is actually the data from outside medicine that concerns that patient, everything around that patient, such as their social networks, their demonstrated behavior in reaction to the way we intervene with their care, and trying to bring that together into a holistic picture so that when we intervene with the patient, we'll have the best chance of actually getting the medicine to be taken and getting the patient to follow the, you know, this is one of the issues in medical care is medication non-adherence, to follow treatment, to believe in it. And I think a lot of that has to do with a new relationship we're trying to build with patients. Because of technology, we can now have visibility into more of their intimate life outside the clinic. And so we know more about them, and the trade-off is we hopefully can offer value in terms of tailoring things that will be more effective for them.
So one last question. In your role of Director of Innovation and Advanced Technologies at Kaiser, you have a unique insight, a unique perspective. Would you say in big data and healthcare, optimistic, neutral, or pessimistic?
Definitely optimistic, but it may not be for about 2-3 years. I think once everybody puts their medical record in place, even the physicians will ask the question, what's the value of the data?
All right,
Okay.
Thank you very much,
Thank
John.
you, all right. Good, thank you.